Today we're going to discuss image acquisition for the lung exam. You can use any number of probes to do your exam. You can use the phased array, you can use the linear probe, or even the curvilinear probe. It depends on the patient body habitus and what you're looking at. The linear probe shows a lot more detail at a shorter depth, thus you'll get a better view of the pleura, especially anteriorly. But it's up to you, just got to adjust your gain and your depth. The indicator you can see here I'm pointing to, you want that towards the head of the patient. And so for the lung exam, you can approach it for a pneumothorax and you can just look anteriorly, air rises, and so we'll start with the most anterior view of the patient. You want to center the pleura, and you can see between the ribs. Here's the pleura. Take some nice breaths. You can see the low comet tails. Yep, and you can see the pleura sliding back and forth. Breathe normally. And then you can see that, but to confirm, you can also use M mode with this motion. And you put the cursor over top of the pleura here. Hit M mode again. And this is when you see your sky beach appearance. You can freeze that. You can see a clear distinction between the upper and the lower. This represents the pleura here. This is the soft tissue, and this is the lung below. So that's the pneumothorax approach. So now if you're doing one for a general dyspnea workup, you typically want to do 4 views on each lung. And so we'll start with view number 1 is typically similar than we did. So this is number 1 view anteriorly. Center it. You look for B lines. Sometimes you can catch a little A line here. You see the pleura moving. Then you slide down and basically you track down the chest posteriorly. So stage or position 2 is just about here, kind of anterior axillary line. You see the same thing. You see the pleura sliding back and forth. You're looking for B lines or artifacts or signs of pneumonia. And then you slide further down. It's almost like posterior axillary line here. The same thing. You see the pleura here sliding. You can adjust your depth. And then the 4th view is usually the most dependent posterior view, and this is where you're kind of getting the junction between the spleen and the diaphragm. And so this is actually the spleen you're catching here, and when he breathes you can see, and you can slide, there's the bottom of the lung. So if you saw fluid, it would be darker or anechoic here. So to review, there's 4 stages or positions. Posteriorly, there's 2, and then anteriorly, there's 2 as well. If it's just pneumothorax you're looking at, you just look anteriorly, and then you can use M mode as needed.